years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the Living a Longer and Healthier Life show. We're going to be talking hormones on the program tonight. Not a topic that we've tackled for a while. I can't even think of how long, but a very important topic, that we have for you tonight. We're going to be on with Carolyn Zaumeyer. She's an MSN APRN. More importantly, she's with lowteflorida.com, so she's helping men and women with hormone, issues with her bioidentical hormones. She's joining me to talk about the human body's genetic makeup. And, of course, I did a little research on hormones before this. They're the molecules we need every day to stimulate specific cells or tissues into healthy action.
Good job.
Thank you, Carolyn. Welcome.
Thank you.
We're so happy to have you.
I surrender.
And, we're live on Facebook as well, on All County Healthcare's page. But let's get right into it. Tell us a little bit about your medical specialty, because I know you're an MSN and APRN, and I will butcher that. So please.
That's okay. We can just leave that out. I'm Carolyn, and what I do, I'm a nurse practitioner, and I have been for many, many years. And I started off with gynecology, and with gynecology, I was finding that the women approaching menopause and going through menopause were really suffering. And we needed to find a solution for that. So back in the day, it was synthetic hormones, Premarin and such. And I was getting great phone calls from the patients that they were feeling much better. Some of their symptoms were resolved. They liked themselves better. Their partner liked them better. It was all good. And then in 2002, there was this huge study that actually had to be halted because the results were so shocking that the synthetic hormones were actually causing deep vein thrombosis, heart attack, stroke, and even breast cancer and an increased risk of Alzheimer's. So about 80% of the people and the women in the country that were on synthetic hormones came off, and so we needed to find a better solution. So I had heard about bioidentical hormones, but I had never really studied it. They didn't teach it in school, and they don't teach it in medical school either. And so I decided to become the best. I wanted to really know that I was giving my patients the right hormone, the right amount, and the safest delivery system possible. So I searched out our nation's greats, and I went to Salt Lake City and studied. I went to Orlando, to Naples, and I still was very frustrated because nobody was teaching me how to dose it properly. So I was chatting with a friend of mine, a doctor in Utah, and he said, you have to go to Texas and study under Dr. Gary Donovitz at BioT Medical. So I said, okay, I'll give it a go. What do I have to lose? So I pack up, go off to Texas, and sure enough, he filled in the gaps of my knowledge, gave me the confidence, and taught me how to personalize the dosing for every single patient. So every patient gets a different dose, and it's specifically based on their medical history combined with their laboratory results. We have a computerized program where we put it all together, and it populates like a starting dose, so we know exactly where to start. But then in 6 weeks after, we test your blood to really fine-tune it to make sure we're right where we want to be.
Of course, yeah, because you got to have the perfect levels, and it's so important. You took the next step of learning about dosing. I mean, that is a genius, because that's gonna help people in the long run, because anytime you're putting things into the body, even hormones, they got to be at the right levels, right?
Yes.
And you made another great point I want to go a little bit off on. So the early on there was like synthetic hormones that were man-made, I guess, right?
They were actually based from pregnant mare's horse urine.
Mm-hmm. Oh, wow.
Sounds delicious, huh? Yeah. That's what you want to take every day, don't you? No. But it was, created or affected in the laboratory. Mm-hmm. What we use is plant-based. It's originated from a Mexican yam, of all things. I mean,
oh, wow.
Who cut into a yam and found a hormone? I'm not quite sure. Yeah. But I'm glad they did. So that's why you don't hear about it much, is because Big Pharma can't patent it, because it's all natural. They're not discovering, there's nothing proprietary about it, so that they can't really label it as theirs. Mm-hmm. So I heard right now they're trying to mix it, I think, with Zoloft to make like a female Viagra kind of thing, the testosterone. But from what I understand, the warnings are on it that the women have to take it 8 hours before they think they might be intimate, and then they can't drink a glass of wine during that time. So they get to have sober sex and hope for the best.
Yeah, that's
I'd rather
not going to work. Definitely. We're here with Carolyn Zaumeyer. We're talking hormones tonight. She's an MSN APRN with Low TE Florida. It's lowteflorida.com. Take a look. Amazing website. A ton of info. Let's start with men, because, men nowadays, you may see them in a plastic surgery office. You may see them, interested in hormones. You may see them in other areas where a few years ago that wasn't the case, So let's start with men for once, because
let's pick on the men.
Yeah,
I got
definitely.
This. Yeah,
and I'm man, so I want to know a little bit about it. It's BHRT for men. Let's talk a little bit about that. What is BHRT?
Well, your hormones, you're basically, for men, their hormones are basically testosterone that is produced in the testes, and as time goes on, you produce less and less. And there's over 400 functions of testosterone in your body. So when it starts to go away, you just don't feel like your old self. You don't feel your best. Some things aren't working the way they should. Maybe gaining weight, feeling a little fatigued, just not, maybe brain fog, joint pain. There's a whole lot of different things that'll pop up with testosterone when it's declining, and it doesn't necessarily depend on your chronological age. I've got some patients that are like maybe in their early 30s, and their testosterone is lower than their father that I treat. So it just depends on your life, of your exposures to different, chemicals, to if you played football, had head injury, like concussion, that can add to it. So there's a lot of different things that can lead to it. And so if we can treat it naturally with bioidentical hormones, we can give you a better life, more energy, better sleep. Sex seems to work better. Sexual satisfaction is better for both men and women.
I always say that term, and you just said it. I have a lot of doctors and nurses on the show, CEOs. Quality of life. You just said it right there. When you're living a better quality of life, you're going to be happier. You're going to be healthier. Yeah. We all know that. We've all been up and down.
Absolutely.
I mean, I've shared on this show. I've been down. I've been up. And when you're feeling great, everything seems to fall into place, especially with the brain, the body, and the heart.
Yeah. What I always say is we don't know how much we have left to live. It could be today, we could get squished out here in the car. Or it could be 50 years from now with all these, organic foods and drinking our water and getting good sleep and all that. We don't know where our end point is. But whatever's in between that end point from now to there, I want it to be fabulous. Not just so-so. I want it to be fabulous. And so that's what we do with our hormones. We help get people feeling their best.
Okay, well, that's great. I'm over here checking off all the boxes, fatigue, this and that, and I'm like, I got every single one, so I guess I got to come on down to Fort Lauderdale at 4540 North Federal Highway in Fort Lauderdale, beautiful Fort Lauderdale, 954-791-4498.
That's it.
It's lowteflorida.com. Carolyn and Low TE Florida are on Facebook, Twitter, YouTube, LinkedIn, Instagram. I think that last one maybe Pinterest.
I don't
Probably,
know. That's
You're
not
everywhere.
my job.
But, just check out the site, lowteflorida.com. So let's talk a little bit about BHRT is also used for women.
Absolutely.
That's surprising that you can cross over men to women, women to men.
What we do with our dosing site, if the woman is menopausal or doesn't have enough estrogen, the estradiol will populate in the dosing site. So we do treat women with estradiol and testosterone. Younger women, I've had some young girls come in, like maybe in their early 30s, saying, "Oh my gosh, I have the best life. I've got a great husband, great kids. a house, a whole thing, but I just don't have that loving feeling. I don't have that sexual desire. And I'll test her testosterone. It'll be so low you can't even measure it. She'll come back after I treat her 6 weeks later, and she feels like a rock star. She's got her life back. She has her mojo. She just feels more like her old self and has those, loving feelings.
Wait, you said testosterone in women. You didn't say estrogen. Women have testosterone too?
Yes, we produce it in our ovaries. I know.
Really?
A lot of people don't know that.
That's why I love doing this show. I always learn something every year. No, I'm serious. I mean,
I know. Even women don't even know. A lot of us don't know that we produce testosterone in our ovaries.
Estrogen.
But for women, you can start to lose it in your late 20s.
Huh.
So things are different. You don't, especially after childbirth, you just don't feel like yourself. And then if we can optimize the hormones, then we can get you back feeling like you should be feeling.
Wow, you're doing great things with the work, and we're going to talk a little bit about your education and training later. You told us a little bit about it, but since we're talking about women, let's talk a little bit about vaginal rejuvenation. And
I know you wanted to talk about vaginal rejuvenation.
Well, I like to talk about everything. So it's the leading solution. You have the leading solution for optimal feminine wellness at any age, and I think you're going to tell us a little bit about FemiLift.
I will. Yes.
Nice.
It's using a CO2 laser, and what it does, as women that have had children, things get stretched out a little bit during the childbirth. Think of the size of the baby's head, and it doesn't always come back to where it was originally. And so, when it becomes more lax in there, you may have mild urinary incontinence, where if you sneeze or jump on a trampoline or do Zumba, you may actually wet yourself a little bit. And so this snugs everything back up. So sexual relations are better. It helps support the urethra, so there's less urinary incontinence. And so a lot of people say that that they can do these things and not have any issues. So I've had a lot of patients have very good results with it.
Again, quality of life. I mean, vaginal rejuvenation, BHRT for women, BHRT for men. You're helping people out left and right. Again, it's lowteflorida.com. Carolyn Zaumeyer, she is in Fort Lauderdale, 4540 North Federal Highway, Fort Lauderdale, just a short skip south of right here where we are in the studio in Boca
across
Raton.
from Holy Cross Hospital.
Oh yeah, I know
just
exactly
south of
where it is.
Commercial
That's a
Boulevard.
nice area.
Should stop in.
Yeah, definitely. I haven't shared too much. I've lost a little bit of weight the last few months. I know, I have some hormone imbalances. It's at 42 years old. I mean,
Well, we have a lot of guys leaning out once they get their pellets.
Yeah.
There's one in particular I can think of, a fire chief, and he's dropped down like 30, 40 pounds. He looks fabulous.
Wow.
Guys will come in. First, they'll come in loose T-shirts when they start with me, and then when they come back in, for their second, third, fourth pellet, they're wearing tight T-shirts and their guns are, showing. So
yeah, they're feeling good about themselves.
Yeah, and they're looking good. Because after 50, you're young, but after 50, it's almost impossible to build muscle without testosterone. So you can work out all day, all night in the gym. You may tone, you may keep what you got, but you're not going to build anything. And so if you want to build your physique, that's what you need, is to bring the testosterone for both men and women. If they want to cut muscles and such.
I think we all do. I mean, we live right next to the beautiful beach, so might as well take advantage of it. Let's hold that thought, Carolyn. On the other side, I do want to talk a little bit about pellet therapy on the Living a Longer and Healthier Life show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the Living a Longer and Healthier Life show. We're here with Carolyn Zaumeyer MSN APRN with Low TE Florida. She's a nurse practitioner, right?
Yes, I am.
I got that right.
Yeah.
So we talked a lot about already BHRT for men, BHRT for women. Check the site out. Again, lowteflorida.com. Learn a little more about that. We talked about vaginal rejuvenation with FemiLift. And you briefly went about the pellet therapy. Now, I don't know much about this, so I really wanted to save this for after the break. If you have any questions, we have about 10 more minutes, 1-888-565-1470, and we'll get you on. So tell me about pellet therapy and how it works, because I know you had a unique case today. I don't know if you want to share it, but it's fine with me. It's my show, and you can share it.
Absolutely. What we use is a pellet, and it's just compacted hormones, and we insert it underneath the skin, underneath where your belt is, into the little fat there. And what it does, when your blood supply passes by, it picks up the little pieces of hormone. And so when your heartbeat is going faster, if you're working out, you're going to get more of a benefit. When you're under stress and your heartbeat is going, you're going to get more of a benefit because it's going to be picking up more testosterone. So the pellet is not time released; it's cardio release, meaning when your blood passes by, it picks it up. We use it for both men and women, as we talked about earlier, and we do the little insertion in the office. And today I've had two interesting patients. One of them was 69, soon to be 7-year-old woman, and she had a butt implant, and so we had to be very careful with our insertion placement, but it all went well. And then I had an 80-year-old man that was ready to feel better. Hey. And so it's like, there's been, of course, a lot more that we had throughout the day, but those two just jumped to mind because they were very special in that they want to feel their best. And it's like, no matter what you have left in your lifetime, why not make it the best?
Kudos to both of them. I mean, they're probably very happy in life. They're probably going to live a very long time. They're promised it. They're probably sexually active, and they're more happier because of that.
Yes.
So definitely, that's great that people are taking advantage of what you're doing, what you're offering. I know you started off by telling us how much studying you did and finding out about dosing. So that's so important. This is the question I really wanted to get to because I'm always up and down with weight. I try very hard. I everyone knows the story. I played football. I never lost the weight. Whatever. Weight loss. How can you help with weight loss?
We have a couple different programs. So a lot of times people want to say, well, will the pellets help me lose weight? Well, absolutely. If you're feeling better, if you have more energy, if you have a better night's sleep, you feel better about yourself, you feel more like making better food choices, feel more like working out. And when you do work out, you get better results. You can lift heavier, run further. And so that does help with weight loss. But it does take an effort, of course. That's not a magic bullet. So I get some people that, I've had the pellet for 2 weeks and I haven't lost any weight. Well, you got to do your part. And, what the pellet's going to do is get your body functioning like it did maybe 10, 15 years ago, giving you back what you naturally produced before so that everything can function in your body and it can work properly. So we encourage that, that's one of our first steps. But we do have an HCG diet where it's been around for 40, 50 years. It's very, very safe. You have to give yourself a tiny little injection. But it's a quick weight loss in that we do a 3-week program because we want you to have success. Going longer than that is overwhelming if you don't have that light at the end of the tunnel. And you just buckle down for 3 weeks and follow our program. And most people lose between 10 and 20 pounds in those 21 days. And so then we teach you how to lock it in so that you don't just gain it right back.
Let me tell you, I did a testimonial on a gentleman who had hip surgery recently. And I actually interviewed him, and he told me about this, exactly what you're talking about. What's it?
HCG, human chorionic gonadotropin.
And he told me the exact 3 weeks. And it really works. Yeah. I think he pinched a little bit of his belly fat.
Yeah, you got to punish it.
He said, it's nothing.
It's a little tiny diabetic needle and just a little bit of juice.
He goes, I still have to stay on my, a good diet, lots of water, I stay away from the rice pasta, what we know, bread, stuff we know stay. But that really works.
It does.
I've seen it firsthand.
Yeah. And it's interesting because I've tested it and you don't have an appetite when you're on it if you've done it properly. You don't have an appetite, your energy is good, and the fat, you just wake up wanting to get on the scale, and it's like that's a new feeling for a lot of people, and they can get back to those cute clothes in the back of their closet.
Yeah,
and,
I mean,
feel good.
Whenever you get to go shopping for new clothes, and especially if it's a different size, I mean, men and women, it's really it's life changing. I mean, you just feel great. So we've talked a lot about how you help out with inside the body with hormone therapy and other options there, but let's talk a little bit about the outside of the body aesthetic services. You also offer that?
Yes. We have a fabulous nurse practitioner that works with us. Her name is Rochelle Storm, and she does the Botox and Dysport, which is basically kind of works the same way. And it's, she helps you decide which one is appropriate for you. And then also fillers. And so fillers are good for like the deep nasolabial folds. I've seen women where before they had it done, they looked kind of like older, and then afterwards it really like took 10 years off their face, and it's really remarkable. She also does some skin resurfacing type stuff with microneedling. That's very popular these days. And dermabrasion, and she's an expert. She teaches it to doctors and nurse practitioners. So everybody is always like, with the Groupons and all that, how much a unit do you charge for your Botox? It's not how much per unit, it's who is injecting it. Because sure, an unskilled provider can, fill you up with a bunch of over-diluted stuff and you won't get a good result. Where an expert goes in and hits the exact points and uses less, you're going to end up paying the same amount and getting a far better result. So you don't take your face to Kmart.
No, definitely. And you said the key word there is expert. I mean, you're an expert.
Yeah, she's
an expert.
A master injector. I mean, she teaches at least once a month doctors and nurse practitioners how to do this. And so she assesses the whole face of the symmetry and what needs to be changed and talks to you about it in front of a mirror to find out what your goals are, and then helps get you there. And then has you come back after she treats you 2 weeks later to make sure you're happy with it. And if you need a little touch-up, she does that then.
So women flock there. Once in a while you see a man in there?
I heard a man in that room today. Yeah, he was laughing, having a good time, getting some Botox in that forehead. So everybody wants to look a little bit younger. We don't mind aging. We just don't want to look like it.
Definitely, yeah.
So
that's great services you offer. Again, it's Low TE Florida. You can find them at lowteflorida.com, 4540 North Federal Highway in Fort Lauderdale. 954-791-4498, and we're with Carolyn Zaumeyer. She's an MSN APRN nurse practitioner. So people are probably thinking right now, I'd love to go over there. I wonder if, is there any way my insurance covers it? Because I know insurance umbrellas now, who reads the fine print, but sometimes, or is it cash pay?
Insurance doesn't want you to feel well, though. That's the problem, and they want to pay less.
I always say it because people save up. I've saved up for things that weren't covered for insurance.
We keep it cost affordable. We have patients that work at Trader Joe's as cashiers. We have housekeepers. We have waitresses, and we have multimillionaires, and everything in between. So it is affordable. What it ends up being for both men and women is $100 and change a month to feel really well. Initially, there's a consultation that's usually $150, but if you mention tonight's radio show, you get a special of a free consultation where you get to come in and sit across the table from me, give me your medical history, and we'll talk about it and see if this is appropriate for you. After that, if you want, you can get your labs, if you can have your primary write it done through your insurance, or you can have it done at our office for $195. And then for the pellet procedure is $350 for women, but that lasts you for 3 to 5 months. For men, it's either $650 or $750, but that lasts 5 to 7 months. So it ends up being $100 and change to really feel well. So a lot of people budget for it. I have one woman that drives for delivery dudes before she's due for her pellet to save up.
Or Uber,
so they
or
find
Lyft.
a way. They find a way. Once you've had it, you'll want it again. You'll just feel so much better. It's life changing.
Well, listen, when I was counting my pennies and dollars for things, and when I wanted to save up, I really wanted something. You know what I did? Cut out that $4 Starbucks every day. Cut out that, trip to McDonald's. And you know what? Take that cash and put it away for what you really want. And it'll be there. We're talking like $1 a day here to feel great, better quality of life. You're just going to beam, You're beaming, so I know it works.
For me, it was the energy. Before I optimized my hormones with the pellets, I was getting through my day. But my goal at the end of my day of work was to go home, feed and walk my dogs, put my jammies on, pour a mug of wine, and hit the couch. I was exhausted. Then after I got my pellet, I found I wanted to do those things after I got home, cleaning the garage, painting the baseboards, and actually having a life. So for me, that was a big game changer.
That's great, Carolyn. I'd love to have you on again, or maybe we can come to you in Fort Lauderdale. This is
Absolutely.
Great knowledge. Again, it's Carolyn Zaumeyer MSN APRN, lowteflorida.com, 4540 North Federal Highway, Fort Lauderdale, 954-791-4498. Give her a call. Go see her. They got great services. We'll see you next time on a Living a Longer and Healthier Life show.
Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.